Now, that's only just 3 years from now. And as already mentioned by previous speakers, we still have a lot of catch-up. As we will see from the figures, we still have a lot of catch-up. As of 2021, 85% of people with HIV knew their status. At the end of 2021, 85% of people living with HIV knew their status. These numbers have subsequently increased, as we'll be able to reflect. 88% of those who knew their status were also on treatment, and 92% of those who were getting treatment had their virus controlled. The Free State has done exceptionally well in terms of testing, having already surpassed the 94% of those who know their status. The problem is in terms of treatment and suppression. The overall population served by the public and private sectors in this province is now at 94% of people knowing their status. 86% of those who know their status are on treatment, and 92% of those who are on treatment are virally suppressed. But there's still a lot which we need to do to make sure that we can actually, in the next 3 years, reach 95% across the board for knowing your status, being on treatment, but also making sure that you are virally suppressed. The results from districts, some of the districts, are nevertheless not at the same level as it is across the province. Districts such as Harib and Lijoliputswa, they're still lagging behind, and we need to catch up. It's even more concerning in that we need to intervene to create a balance amongst these targets in order to reach our 0 new infections by 2030. What we need to do, it means that we need to bring more services closer to the people, closer in our health facilities, but also in terms of outreach programs, and make sure that we do have the resources in terms of treatment. Now, I have been assured by our team here from the province, but also nationally, that at the present moment, our leaders from SANAC and all the leaders from the civil society, from the private sector, at the present moment, and also thanks to our partners who are giving us support, PEPFAR, Global Health, and all the others who are giving us that support, we don't have a problem in terms of actual availability of antiretrovirals. So what we need to do is more to make sure that we can test more people and make sure that we can reach out to them and start the treatment. At the present moment, we don't really have a major challenge in terms of actual availability of ARVs. Despite the fact that our country's HIV prevalence has been going down, as already reflected earlier on, from 2010 up to where we are now, almost over 45% reduction, we still have a very high prevalence of 13.5%, which has been the same over the last 5 years. And that is so because the number of people, as the population increases, the number of people who are HIV positive is still growing. So that's where we need to stop. We need to close the tap at the level of new infections. So the path that our country has taken, as well as our contribution to the mission of achieving the objective of 0 AIDS-related deaths, we must make sure that we reach 0 new infections. But also we must deal with the stigma, we must deal with the prejudice, which a number of speakers have already spoken about. In the past year, KwaZulu-Natal, Mpumalanga, and the Free State Province had the highest prevalence of HIV. KwaZulu-Natal at the prevalence of 18.3%, Mpumalanga at 15.9%, and the Free State at the level of 14.8%. While the Western Cape was the province with the lowest at 8.3%, followed by Northern Cape. So it looks like the Capes have a lower prevalence of HIV. Dr. Hopani, your province of Northern Cape is amongst those which still have a lower prevalence, but at the end, we want the 0 infections. So we appreciate those which are at the lower level, but we must all push our districts and provinces to make sure that we can reduce our new infections. The majority of burden of new infections is largely in the Black African community, vulnerable populations, and that's where we need to put our focus. Our concerted effort now needs to address the alarming and substantial increase in the new infections amongst the young population, which is continuing to rise. It's a critical area which we need to all put our efforts to focus on. These new infections occur in young people, especially between the ages of 15 and 24. And these are this is really the wealth of our country, the young people. And according to the research, this is continued to be rising. According to the Tembisa model, the infections amongst young people is still rising, and that's where we need to really put a lot of efforts.